Hey everybody, I'm Dr. Jeff Cumro, and today in this video we are going to talk about the rising cost of healthcare and the way that I see out of this. And when we look at the stats, health insurance has gone up 47% over the last 10 years. Cost of healthcare has risen massively, and it does every single year. When we look at the long-term costs of these chronic diseases, they're absolutely insane. They're through the roof. We're talking anywhere from mid six figures and up as far as chronic disease goes. That's diabetes and cancer, Alzheimer's, heart disease, strokes, things like that. They're massively expensive. And anytime that we have something that is that expensive, then the people that pay for it are going to increase their prices, right? Their increased cost, their increased price. The insurance industry is going to continue to go up as long as that's there. They don't want to have to pay out, and they're not really so worried about the cause. But if we are going to get out of this situation, we need to be worried about the cause. And there's a lot of research out there, like what is the cause of this? What is the cause of that? And it's very conflicting in the causes, right? There aren't too many people that can tell you this is what causes this, this is what causes this, this is what causes this. And if we could get just straight information on that stuff, then it would be much easier to come up with a solution, right? But it's a lot of conflicting things. And a good example of this is, when you look at a diet, what type of diet are you going to do? Some people are going to tell you that a low oxalate diet is the right way to go. Some people are going to tell you that a low lectin diet is the right way. Some people are going to tell you that food intolerances are the right way. And there are a lot of different ways that you can decrease your inflammation and you can improve your health. But what is the right way for you? We don't have things individualized great right now. That we have gold standards for medicine and those are great things because they protect the consumer. But at the same time, when we're looking at a one-size-fits-all program, it's not going to get you to an optimized state, right? Because we've got to look at what your genetics are, what your epigenetics are, what your tastes are. Like, what do you like doing? What do you not like doing? How do we get you from where you're at to where you want to go? We have to customize a plan. What do we look at when we wait until we have disease to treat? That's the traditional model, right? If you don't have symptoms, you're healthy. That's not the case at all. So many of us are sick and we have no idea. There are so many people walking around the US with undiagnosed diabetes. It's a very scary situation because like 33% of people will end up having diabetes is what the projections are. The cost of diabetes is just astronomical. 1 of every 4 of our healthcare dollars is spent on diabetes care. And that's just direct cost. That's not increased insurance deductibles. That's not increased premiums. It's not absenteeism from work. It's not lost productivity. It is just the medical costs. 1 in 4 of our healthcare dollars. And you guys know how expensive healthcare is. Like, it's a massive amount of money. And we have another large group of people that are walking around without any idea that they have diabetes. We've got to change the paradigm of health. We have to change how we look at health. And if we look at how we are if we change the way that we are looking at it, then we actually have some power over where we're headed with this, right? Because it's easy to look at, government will take care of it. They'll make the decision for us and we can go forward from there. And that's fine, but what governments aren't good at looking at are what are the second order, the third order, the fourth order, or the fifth order consequences of all their decisions. So they might make a decision that is going to help overall, but what are the other consequences of that? What else changes with that? We don't have any power in that. And empowerment is such an important part of health. If you're not empowered to make that change, if you don't know how to make a change, if you don't know that you can make a change, you're stuck, right? And that's the thing, that we have so many people that are unaware that they have power to make a change. They're just so beaten down that they don't think that they can do anything. They don't want to take action because, like, what's the point? It's a waste of my time. I don't have the knowledge. I don't have the money. I don't have the time. I don't have whatever it is. There's a lot of excuses, but they're basically their health has just been taken away from them. Even though there are a lot of things that they could do that don't cost any money, that don't take much time, right? Eating a little bit healthier, drinking more water, getting sleep, managing your stress through like journaling or exercise or different things like that. They're not things that have to be expensive. There are a lot of things that we can do on our own that are going to take our health to that next level. But we've got to stop waiting until everything has fallen apart to address our healthcare. We need to actually just, work on optimizing our health. We need to work on detoxifying ourselves and really healing our bodies in general before we actually get sick. We need to have customized plans on how we can do that. We need to invest in our health and spend a little bit of money before we actually get sick, because when we get disease, it's massively expensive. But that shift only happens if we make that shift. We have to be the ones that sit here and say, I'm going to make that change. I'm going to do this, because nobody else is going to do that for you. Nobody else can do that for you. And a lot of it just comes down to lack of awareness. There are a lot of people that don't know that they can do things on their own, that they can actually make a change before they get sick. They've been convinced that your genetics are what your genetics are, and you're going to have this if you have this gene. It's not true. It's not true. It is flat out 100% a lie. Why? Because epigenetics control things. Our epigenetics tell us, basically our epigenetics are like a light switch. Your light switch is either on or off. If your light switch is on, that gene gets expressed. If your light switch is off, the light switch or the gene gets turned off, right? So you might have a bad gene that gets turned off, never express any sort of disease, right? There are a lot of people out there that they have, the BRCA gene or whatever else. They don't ever get breast cancer because that gene is turned off. What empowers us on epigenetics? There are a lot of things that change epigenetics. Lifestyle changes are phenomenal for changing epigenetics. The only thing that we are lagging in that is we don't know which change is going to lead to which epigenetic switch being flipped. What we do know is that healthy lifestyle changes turn off more of those bad epigenetic markers and on more of the good ones, versus negative lifestyle choices turn on more of the bad ones and turn off more of the good ones. Again, we have a lot of power. There are a lot of things that we can do, and when we see this and when we know this and when we can take action on this, that's where healthcare changes. That's where our prices come down. That's where we have control. And like I said, that's really the only solution that I can see out of this. I don't see a situation where somebody else is going to come in and be able to save us on this. So I know that it's going to be easy for people to look at this and say, that's a political stance. And it's not. It really 100% truly is not. I am all for you taking care of you, because I don't think anybody else is able to take care of us. I think that we have to just change our view. Wayne Dyer, one of my favorite quotes, if you change the way you look at things, the things you look at change. How can we do it? How can we make this change? How can we take that next step? What can we do first? Where can we begin? Things like that change the way that we are seeing the problem, and they give us power to act, right? Where is the right intervention point for you? How do you go about that next step? I want you to think about that between now and the next video. So I really greatly appreciate you tuning in. I hope you have a phenomenal week, and I'll catch you soon.